Good afternoon, everybody. It is Friday afternoon, 2 p.m. Sorry, it's 1 p.m. today. We've changed our times a bit, and it's Fertility Talk. Today, we are talking to Claire Strydom. She is from Nutritional Solutions, and she's also known as the PCOS boss on Instagram. So thank you very much for joining us. Today, we're talking all about PCOS and the nutrition that you would need when you are diagnosed with PCOS. So thank you once again, Claire, for joining us and agreeing to do this talk with us.
It's a pleasure, Lee. Thanks for having me on.
Pleasure. Claire, I think we will just, if you could maybe just give us a quick background of what it is that you do and where you're from.
So I am a registered dietitian. I've been in clinical practice now for 17 years. And I myself have PCOS. So I specifically really enjoy working with women with PCOS and helping them because, as those of you that suffer with this condition, it is a lifelong condition that you can manage so well that you don't have any symptoms. And that's what I strive to do with my patients. So yeah, that's what I do, Lee, and I enjoy it very much.
Okay, great. It's always nice when you're talking to someone, especially about PCOS, that person actually does understand PCOS. And I think the only way is when you yourself suffer from PCOS, because it's easy to hear it from a dietitian that doesn't have it and it's got the perfect little body, and they're telling you, oh no, you must just do this and that and that, where they don't understand what actually goes into it when dealing with PCOS. So I'm going to start off with the questions that we have is, what is PCOS? Can you give us a rundown of that, please?
So PCOS is basically order that we see, especially around women with fertility. Actually, a very large percentage, I think it's actually in the 90s percentages there around, of women that go to fertility clinics actually have PCOS. And that also affects our metabolic functioning or hormonal disturbances. It's a hormonal imbalance. So we often see high androgens, high testosterone, the high insulin levels, high inflammatory markers like C-reactive protein. These are all markers that we see in women with PCOS. We get different phenotypes. You actually get lean PCOS women. The majority of women with PCOS do battle with their weight, but we get the different phenotypes where some battle more with androgens, some battle more with inflammation, some battle more with insulin. Sometimes they've got all three together, mixed together. So it is still, it's individualized. We have to treat this condition for each person based on what they are battling with.
Okay. Sorry, were you going to say something else, Claire?
No, I'm good.
Okay. What are some of the symptoms of PCOS?
So some of the key symptoms that we see is irregular periods. So often ladies have no period at all or very long cycles. We see things like hirsutism, which is hair growth. We see terrible acne, hair loss. We get the darkening here in the skin on the, we see it under the arms and the groin and the neck. We get the skin tags. I've had ladies literally that shave their beards, and you get the male pattern hair growth with the male pattern hair loss. So it's hard. It's not it's hard. And weight gain is also a common issue. That terrible struggle with weight loss is very common for women with PCOS. Sleep disturbances. We also see things like high triglycerides. There's a lot of things. We know that nutrient deficiencies are also very rife in this condition, but those are the clinical symptoms that we almost see PCOS coming into your office. I can see the lady sitting in front of me and I can go, oh, there's the hair, there's the acne, there's the balding in the top here on the front. I see it.
Yeah, I funny that you mentioned skin tags. There's very few people that actually mention skin tags. But just like our last conversation, I learned so much from you because you really went, it's like you dig deeper when it comes to PCOS. You really know, because I actually went to a doctor one day and I said, I've got all these skin tags, so I never ever wear anything around my neck because of skin tags. And I actually go once a year and I have it removed by a dermatologist. And the doctor said to me, I said, I've got PCOS and this is my skin tags is because of the PCOS. And they're like, no, it can't be. I'm like, but it is. It's PCOS, and I think a lot of people are just not informed about it. So you've got this, and they say it's something else. So thank you. How are we diagnosed with PCOS?
So when they look at the diagnosis of PCOS, they want this, out of the 3, you want 2 of the following. So they either have, well, you don't want it, but this is what they look at for the diagnosis. They have oli or anovulation, so you're not ovulating properly, or polycystic, or there's little strings of pills on the ovary. So you can have polycystic ovarian syndrome without having any cysts. Okay, that's also something to understand, because some people say, well, I got diagnosed, but on the scan, I never had cysts. You can have high androgens and not be ovulating, but not have cysts and still have PCOS. Okay, so there's these little combinations that I think that's also why it makes it so tricky. And then the third is any clinical or biochemical signs of androgen or hyperandrogenism. So that's the hair loss, the acne, the hair growth, those symptoms that we were mentioning before. So high androgens, polycystic ovaries, or anovulation, any 2 of the 3 is diagnostic criteria for PCOS.
Okay, so it doesn't matter even if you have, you don't have to have all, in other words. You know, some people say, no, but I don't have this and that. So often the whole not having a cyst, people get missed. Yeah.
As getting their proper diagnosis because of that. You often hear about women having to see multiple practitioners before they actually get diagnosed with this condition. And I think sometimes the diagnostic criteria makes it tricky because people don't always understand all those different concepts around it, I guess.
Yeah. Okay. How important is our nutritional intake when being diagnosed with PCOS?
It's critical. It's really, really important, because the first thing that happens, I find, is women battle with their weight. So they're just cutting back. So one of the biggest issues I see with my ladies that I work with PCOS is the undereating. Number one, most of them are not getting enough of the good stuff in. Okay, so their diets are not nutrient dense, more higher chances of mineral and vitamin deficiencies. So we often see magnesium deficiency, vitamin D deficiency, low B12, often low iron if they're having heavy menstrual cycles. So you want a diet rich in nutrients and enough protein, enough fiber, enough good fats. We need omega. And Leah, I can probably speak to anybody on this call or on this session. If you are not looking at your nutrition with your PCOS, you're missing the bottom foundation of your treatment intervention. It should be the core therapy to starting to treat your condition and manage it well.
Wow. Okay. I see our connection is a bit bad, Claire, but I think we'll get through it. I actually think it's on my side. Sorry about that. What foods are recommended, or what is not recommended? Sorry, Claire?
Start with what should we be eating.
Yeah.
Can you hear me? Let's start with what we should be getting in. And this is the number one thing you have to get in every single day is a variety of colorful vegetables. 4 cups of vegetables every day. Why I'm saying this is PCOS is fundamentally also an inflammatory condition. And when you take in high intakes of vegetables, you start supporting phytonutrient intake into your diet, which helps to reduce inflammation in the diet. That's number one. So if you're not getting the veg right, start there. That's the starting point, okay? The second point is you need adequate protein, but the types of protein you eat are also really important. There was a study that showed that in women with PCOS, if they had high protein intake and it was too high of chicken and meat, they had 39 to 41% ovulatory infertility by eating too much red meat and chicken. So what happens is we see ladies going onto bad diets and doing paleo and what, and now their hormones are all over the show because they're actually making the fertility possibly worse. So we know that things like fish is really good and legumes are really good, and you can actually have dairy from an ovulatory infertility perspective with protein intakes and eggs, dairies, and I will get to dairy because that's a contentious topic. Lee, we'll chat about that in a minute. But you need enough protein, but you need the right type of protein. So I always get my ladies to start eating a lot more fish, specifically omega-3 rich fish. It's like a little tongue tire. But things like pilchards, sardines, salmon, The mackerel and trout are really high in omega-3. So your hake and your tuna is not. So you need to get the fatty fish in because it's high in those omega-3s, and the omega-3s also down-regulate the inflammation, okay? So protein's really important, veg is really important. Then the type of fat that you use in your diet. So if you are using butter, cream, coconut oil, all the saturated fats, they are not good for insulin sensitivity. We talk about cell membrane permeability. They are short, hard-chain fats. They're going to make your cell membranes look like this. If you try and shove a pen through this, it's not going to go, okay? Yeah. You're going to make the cell membranes becoming harder at a cellular level, meaning you need more insulin to improve cell membrane permeability. So I don't want to confuse anyone with these high words or whatever, but the saturated fats are a harder, shorter chain. The monounsaturated fats, so olive oil, avo, nuts, nut butters, olives, they're a long chain, single bond, monounsaturated fat. They look like this. Getting glucose into that cell is a lot easier, which means you need less insulin. The cell membrane permeability is better with good quality fat in the diet. So choose the best fat. I switch all my ladies in the beginning. I say, just use olive oil for now. Just start off. You have 3 teaspoons of olive oil for your cooking and for your veggies and your salads and whatever you want to have in a day. And let's get the good fats in. So I think it's also very importantly that I try not to get stuck with my patients on you can't have this, you can't, yeah. Because already you've had PCOS forever. You feel horrible about it already. So now be told you can't eat this, what. You actually get so down and depressed about it. And I don't like to do that. So I really focus with my patients, say, let's get the good stuff in. Let's go for it, get the good stuff in. The other thing is you absolutely still need carbs because people are like, oh, no. Carbs cannot touch it because of PCOS. Actually, the opposite is true because we need fiber. So they actually published a big obesity and overweight guideline at the end of last year, the Canadian guidelines, that showed that things like ketogenic diets are not actually good for our health, and we need things like fiber in our diet. So we can reduce carbohydrates for sure, but we should not be cutting them out and losing fiber. When we put more fiber into the diet of a PCOS woman, we improve her short-chain fatty acid production. There's a specifically one called acetate. Again, drops inflammation. It also changes how we use leptin, ghrelin, insulin secretions, all because of short-chain fatty acid from fiber. Okay, so even if we just go on those key things, the fiber, the fats, the protein, and the veggies, you can make huge change with your nutrition with those key areas.
Okay. Wow.
It was a mouthful.
That was, but I'm actually really understanding. Sorry, I was trying to take everything in and actually listen to what you're saying. I was like, okay, that does actually make sense. Thank you, Claire. And then what supplements are recommended when you are diagnosed with PCOS?
So I think the first thing that I would say to anybody that gets diagnosed is you have to do proper blood sleep because you can't guess. This is not a guessing game. We need to understand what is your androgens, what is your testosterone, what is your luteinizing hormone, your follicle stimulating hormones, what are the ratios like, the insulin levels. We look at a whole bunch of things. We look at magnesium, vitamin D, C-reactive protein. And then based on that, we start looking at what do you need and what dosages. So for example, we know inositols are really, really showing to be amazing in PCOS. There was a systematic review published last year that said that when we use 4,000 milligrams of myo-inositol with 100 milligrams of d-chiro-inositol, that combination is really good and it helps with PCOS from a hormonal perspective, from an insulin resistance perspective. But what's very importantly is that we don't get those dosages or the ratios incorrect. Okay. So what people need to look out for when you buy your inositol, you want to have 4,000 milligrams of the myo-inositol with 100 milligrams of the d-chiro-inositol. Why this is important is because it's in a 40-to-1 ratio. And we know that that 40-to-1 ratio is the natural ratio we find in the tissue in the body. Now, why this ratio is so important is in women with PCOS, if we don't give them that 40-to-1 ratio and we just give them the myo-inositol, they can overproduce D-chiroinositol, but to the point that it actually has negative effects on fertility.
Oh.
Okay, which is really important, because if you're trying to fall pregnant and you're using the wrong dosages of inositols with the wrong ratios, you could actually making your infertility worse. It's called the paradox effect with that ratio and the myo to D-chiro. So that's one aspect. We also look at omega-3s. We look at magnesium, vitamin D, vitamin B12. So many women get put onto metformin, and one of the side effects of metformin is vitamin B12 deficiency. Yeah. And often patients aren't told, here's your glucophage, and here is your vitamin B with it. And by the time I see them, I say, you've been on this for how many years? No, 5 years. Have you taken B12? No. We start looking at symptoms, and then we test them, and they are vitamin B12 deficient. So it's so important that we are aware that these full spectrum blood tests are necessary, and adequate supplementation is also then necessary to support where there's a requirement.
Oh, I'm liking what you're saying, that the blood tests are very important. Absolutely. Then I've got another question for you. And if anyone's listening right now, I do see there's a few women live on the page. If you have any questions for Claire relating to PCOS and your nutrition, please just pop a comment, put it in the comment section, and we'll read it at the end of the talk. The next question is, what are in these supplements will help with infertility? I think we actually went through that now, and how it will help us conceive. And then what are the recommended dose? So what actual product is there? So no, Delphine's got a product. Is it PCOSITOL? PCOSITOL, yes.
What's quite nice about the PCOSITOL is it's your inositols with that exact right ratio. Okay. And you're getting magnesium, but you're getting magnesium, you're getting your calcium with vitamin K2, with vitamin D, with vitamin B12 and folic acid. They're all methylated. Now that means it's in a very absorbable format, okay? Because some women have an MTHFR gene mutation and they can't use that folic acid, and it has a negative effect on fertility. So it's in a methylated format. They've also got chromium in there. There's zinc for the acne issues. So the thing with that specific product is they put everything into one sachet for PCOS patients, and it does make it a lot easier to take, and it's one little sachet. About the magnesium, people often ask me, when should you take it? And I always say to them, take it at night. It's got a very, very good dosage of magnesium glycinate. It's a very absorbable format of magnesium, and it really helps with sleep quality. So we always say to ladies, mix it with a big glass of water, give it a stir, leave it for a few minutes, stir it again, then drink it. And I say to my patients, take it after dinner, and it just really also supports sleep. So yeah, there are lots of different nutrient deficiencies we battle with PCOS. So this is also a great maintenance option because it's got the dosages that we need to maintain optimal vitamin D, B12, magnesium, zinc, all those levels that we see that just drop off in PCOS if they're not watched. Yeah.
So it's quite superior compared to the other product that Delphin has. The one that's just got the inositol.
Well, the thing is, you've got to look at the differences in which patient's using what. So PCOSITOL was specifically developed for women with PCOS. It's definitely used for inositols in lots of other places. So you must always understand that each product has its own unique like makeup or formulations for various products. PCOSITOL was specifically made for women with PCOS. We made that product for those women.
Okay. A question about it: does it support or assist when someone is going through IVF? And women are always asking this question: what can I take to help increase my egg quality, for example?
So is this something excellent? Yeah, inositols are very good for that, and the ratio there is really important. I would say to women, even if you're not using PCOSITOL, you must make sure that your supplement that you're using has got the 4,000 milligrams of inositol to the 100 milligrams of D-chiro. Make sure it's a 40-to-1 ratio. You don't want to miss that because it's in the literature. I mean, we're seeing this in the big systematic reviews, which is on massive papers that are being published, showing that when those ratios are wrong, it can have a negative impact on fertility.
Okay.
Another one that I just want to mention, Lee, is vitamin D. We know with vitamin D, it's associated with lower rates of follicle development and pregnancy after stimulation when there's a deficiency. And we also know that vitamin D may improve the reproductive function of women with PCOS, and they restore their reproductive function. So before you go through the whole fertility journey, I would make sure that your vitamin D has been tested. Make sure that it's at a much higher level than just a 20 or a 30. I would say at least 40 to 60, ladies, on our South African range measurements. If we look at the literature around PCOS, vitamin D is critical, especially for the ladies going through fertility leave. They must please all check their vitamin D levels.
Okay, wow. Okay, so there you have it, Lee. I'm sorry, there you have it, Lee. I was saying Lee. Sorry, I'm reading here. I'm trying to see if any of the, you know what happens at the end of every talk, and as soon as we're done with the talk and we all of a sudden we have people commenting and asking questions. So I'm giving it a minute or two. Is there anything else that you would like us like to tell the ladies when it comes to PCOS and nutrition?
So I think the key thing, Lee, is for everybody just to start getting the good stuff in. Don't put this pressure on yourself that you can never ever eat a chocolate again, or because that people also get told that. Shame, I had a lady that said to me, Claire, I know because I eat chocolate, I don't get to have a baby. It's my fault because I ate chocolate. And I said, no, it's not like that. And it's just something I want to teach all the ladies on this call. If you want a little piece of chocolate, you go have your chocolate. It's fine. But let me teach you something really clever. Don't go eat that chocolate at 9 o'clock at night when you're watching Netflix, okay? You eat it at lunchtime rather, and you have a nice big salad with lots of veggies and a piece of chicken or your piece of fish plus your mealie. And then with all that food, you eat your little, you get a small chocolate, lady, not like a whole slab, okay? So like 30, 40 grams is fine just to get your little taste and go have it. This fear mongering that I see on some pages around, oh, you've got PCOS, you can never ever eat this, that, it just puts such unfair pressure on women with PCOS, and it's not necessary. I've got PCOS ladies that have lost 36 kilos, 10 kilos, 20 kilos, and I say to them, have a treat once or twice a week, have a little chocolate or whatever. And you know, the minute you say to someone you can have it now and then, they're like, huh, and then it's much better. And then their nostrils also really help with craving. So if you're somebody that's battling and you want to eat this slab of chocolate every night while you're watching Bridgerton, then nostrils will help you. Promise, it really helps. My one patient said she could feel when she didn't take her little sachet, you know, and she could feel the difference. So look at your supplements, because ladies, if you're craving, if you're feeling fatigued, if you're feeling your acne is out of control, something is up with your PCOS. You need to recheck your bloods, understand what's going on, and then you develop your strategy and your plan of action for your set of results. Don't think that you have to be gluten-free, dairy-free, blah, blah, blah. You do not have to.
Yeah. I love what you said the other after we had the last talk, and you told us about the chocolate and making sure that you have a good meal and then you can eat your chocolate. I was like, okay, I'm going to use that. I'm totally using it. And you know what? It works. It does absolutely work. So I feel guilty nowadays when I get up and say, oh, let me go have, you know, something in the cupboard, get something out of the cupboard. I'm like, no, you can rather eat it with a meal.
Yes, and also by doing that, by saying to yourself, I can eat a chocky, but with a meal at lunchtime. It stops that habitual eating at night. It stops that eating the sweetie pie in the car on the way home. It stops that because now you don't have your proper veggies. So automatically it changes our habits around the chocolates, you see. And I found that that's worked so well over the years with my patients. And they love that they can still have those things and not be.
You don't feel too restricted.
Yes, and it should not be like that, Lee. It's not good.
Yeah. Okay, thank you very much, Claire. Thank you for taking the time out again. I know you're busy. And yeah, we look forward to once again doing this. And I hope that any of the ladies, I'm sure that someone's going to inbox me now and send little comments there, and I'll definitely try and send it your way. And obviously some of the ladies that will contact us. So thank you again. And I hope that it's helped a lot of women and put a few things into perspective when it comes to PCOS and how important nutrition is, how important supplements is. And that it's not just a once-off thing just because you're now trying to conceive. When you have PCOS, it's a lifelong maintenance plan. you know, with,
Exactly.
yeah, it's a
Yes.
maintenance plan. Yeah, so thank you very much. Have a great weekend, Claire.
Pleasure, Lee. Thanks so much. Have a good
It's a
weekend too.
pleasure.
Keep well.
Bye.
Bye.
Bye.